our next section is to go over the American Rescue Plan. So Kathleen Von Atchen is back, and she will walk through the different steps in this process. It is still one that is unfolding, but we wanted to give you a little preliminary information on this evening. Kathleen?
Good evening. So Kathleen Von Atchen, Chief Financial Officer. So this is a wonderful new development for local government, and just wanted to give you a brief overview of the entirety of the bill. So as you know, President Biden signed the $1.9 trillion stimulus package called the American Rescue Plan Act. I'm going to refer to it as ARPA. And this is an image of generally how the 1.9 trillion is broken up by various services that the federal government will be providing assistance to. So this one down below here, this red $360 billion is going to state and local governments. But the 660-page act also includes a whole slew of other assistance programs, and that's where these come in here. So of course, you know, the stimulus checks are down here. Those are going out to individual taxpayers. So in order to help us wrap our head around all of this assistance, I've kind of broken it up into part one and part two. Part one are all of these allocations, either to the state or direct federal grant applications that will address a long list of services to assist UG residents. So that's what all this section is. And then the part two are those direct payments, which are now estimated to be $89.5 million that will be directly paid to the unified government, both city and county, split between 2021 and 2022. So when we talk about ARPA, keep in mind that we need to kind of consider two strategies. Not only do we need to dedicate, you know, resources, staff time to ensure that we are collecting as much as we can from these various state and federal grant applications, but then we also need to evaluate how best to proceed with budgeting or allocating the 89.9 million we expect to receive very soon. So first, I'm going to talk about that part one. So part one, as I mentioned, are, you know, all the assistance opportunities, either through state allocations or federal grants. And I read through the 600-page bill, and I picked out all of the programs that we feel would the unified government would qualify for or assist our residents with. And it's not just unified government, but nonprofits as well. So for example, some of these boxes, you know, there's assistance to assist with our community gardens, with our healthcare workforce, new health centers, there's funding for that, funding for mental health, funding for homelessness, childcare. There's a number of programs in there to assist childcare facilities that were impacted last year during COVID, to help them get back on their feet. There's funding for family violence and domestic violence. There's utility bill assistance for those households that had difficulty keeping up with their utility bills. There's funding for museums and libraries, for rental assistance to those residents that had difficulty keeping up with their rent. There's mortgage assistance. There's funding for transit, increased transit and bus lines to augment funding that was lost during the COVID, you know, shutdown. There's a great deal of money in terms of grants, loans, and a whole variety of different programs for small businesses. There's funding to assist restaurants that closed during this past year to help them get back open. There's funding for funeral assistance to help residents that had funerals last year as a result of a loved one passing away due to COVID. There is funding through the Federal Emergency Management Association to reimburse for costs related to COVID. There's some funding for firefighter grants, both the SAFER grant and the Assistance to Firefighters grant program. There's funding for aging for those area agency on aging, and assistance for our nursing homes. So a lot of different programs. So I actually went through and looked at each of the individual programs, and of those part ones, they total $254 billion. And here's all of the various programs with their dollar amounts. So you can see there. And so here's a percentage of each of those programs. For example, 19% is for testing, contract tracing, and PPE. 15% is for childcare. 12%, let's see, is for public transportation, or no, probably vaccine distribution. No, yeah, public transportation. So, you know, a lot of money for all these various services. And of course, this money is either being distributed through direct grants that we have to apply to the federal government, or funding that's being allocated to the state, and then the state will allocate it to the various counties and cities within the Kansas. So just doing a very rough estimate, because of course we don't know how much each of the states are going to be getting, or how much we don't really know how much will be made available by state. But if we were to look at the total of $254 billion, and if the UG were awarded just 1/10 of 1% of the $254 billion available across the country, it would mean that we would get $25 million more in resources to support small business, social services, public health, and all of these various programs. So there, not only are we getting this $89 million as a direct payment, but there's also opportunity, that we could, at a minimal level, get an additional $25 million to support all of these various activities. Okay. So I know, so the strategy for maximizing the amount of these allocations and grants is we're considering a request for proposal for a consulting firm to assist us with technical assistance to UG staff to help us with cost recovery and emergency advisory services, to do an assessment, planning, and decision making, to help us submit applications, review reimbursement requests, funding, cost reimbursement, and compliance and monitoring and reporting. So very comprehensive list that if we can hire a firm to help us, during this period on a temporary basis to help us maximize these funding opportunities, it would be great. And of course, the cost of the consulting services would be reimbursed from ARPA funding. And, we're also considering forming an internal staff or team to assist with the program administration and oversight. So now the second part is that direct payment that we're anticipating. It's totaling $89 million, but the split is between the city and then the county. So the city is estimated to receive $57.5 million and the counties to receive $32 million. How the ARPA is written, the jurisdictions will be receiving these funds split between 2021 and 2022. So that's what these splits are here. So these direct payments, as I mentioned, they total $89.5 million, 2 tranches. The first tranche for 2021 is expected to be received in a week or two. And then the second tranche would come 12 months later, in the middle of next year. And of course, we will be securely depositing all of these funds into a grant fund until the UG budget process is completed. And then the law says that the funds must be used by December 31st, 2024. So we have 3 years to spend it. And so we have plenty of time to really evaluate how best to strategically budget this one-time money. So I just wanted to give you a little bit more detail on what guidelines we do have. These 4 guidelines are explicitly stated in the law itself, that 600-page document, but Treasury is right now still working on further guidance for the spending. But right now in the bill, it says that number 1, and this isn't necessarily required to be equally distributed, it's just a list of areas where you can spend. So, and not in rank order, it's just how it was listed. So, to respond to the COVID public health crisis through assisting households, small business, and nonprofits, or to aid industries impacted, such as tourism, travel, and hospitality. The second is to respond to workers who are performing essential work through making premium payments for essential workers currently working, as well as grants to essential workers who worked during the crisis. And this one is the third one here is lost revenue and the provision of government services. So we're the provisional services to the extent that the reduction in revenue was due to COVID-19. And then that lost revenue is compared to revenues collected prior to COVID hitting. And then the last category is infrastructure investment, where they specifically list water and sewer and broadband internet. Okay. The only restriction they had on these funds is that you can't use the money and deposit it into a pension fund, which in the state of Kansas would actually not be possible. So just want to give you a little information because we're still waiting to hear on Treasury and to get their guidelines, but they have been making some progress. On April 14th, Treasury created this Office of Recovery Programs to coordinate the disbursement. And they do have this website to manage their portion of the ARPA. And so in the meantime, they're working on 3 items, which is basically they're making sure that they have the right methodology, formulas, and census data. So the $89.5 million is an estimate that was provided to us over a month ago, but that may move or change depending on that analysis. They're establishing the rules on how the funding can be spent, including regulations for funding to cover lost revenue and other items such as water, road, and broadband infrastructure. And then they're, confirming banking information from all of us because, there's a large number of recipients. So $89.5 million is a lot of money. So we think this slide just kind of provides you with some suggested principles when you start thinking about ARPA direct payment budgeting. So the first item I just want to emphasize is that, we have 3 years to spend this money. So let's take the time to make really smart, careful, thought out, data-driven decisions. The second one here is that health experts are predicting that there will be a future health pandemic, that's likely to occur. So we need to keep that in mind, get ready now, make sure that we have everything in place to be able to respond adequately and successfully when that pandemic happens in the future. And of course, we want to make sure we're matching one-time stimulus dollars with one-time expenses. And similarly, we should try and avoid new assets or new programs, launching new programs that are going to drive increased costs in the future that we don't have ongoing money to cover for those operating costs. So, and then using an analogy from when you're in an airplane and they tell you about the mask, be sure to secure your own mask first before assisting others. And what I'm trying to get at here is that we need to replenish our reserves across all the funds in our organization to make sure that going forward we're ready to address any kind of unexpected pandemic or emergencies that may arise. And we should try and invest in areas that will reduce organizational costs, such as, since we have this unexpected resource, perhaps we should defer those costs towards deferred maintenance, because if paying for deferred maintenance ends up saving us money in the long term. And then lastly, consider undertaking cooperation with other regional projects. And throughout the bill, they talk greatly about social equity. It's a very important part of the bill. So we ought to consider all of our funding decisions through the lens of social equity. Spend money on social services and small businesses in a way that averts short-term disaster, but also commit resources for marginalized communities that were hurt by the crisis. So this is generally what a suggested kind of preliminary review process for these 89 million in direct payments. What we are suggesting here is that we first compare, of course, we're waiting on the guidelines, but we need to compare our current needs with the ARPA guidelines that are soon to come out, and then develop a criteria and prioritize our needs based on that criteria. And then we need to take all of those ideas that we have and assess their feasibility, their viability, and the timing of the projects. And then finally, we generally want to be able to evaluate all of this as part of this upcoming 2022 budget through some ARPA workshops, which we're still in, we haven't scheduled those, but we're looking to do that. It's all part of this upcoming 2022 budget. So I think that's all I got. So thank you. Happy to answer questions.
Thank you. Commissioner Philbrook?
Well, I had to be the first to tell you, Kathleen, thank you so much for being on top of this. Oh my gosh. I know it's complicated as heck, kind of like when we went through the CARES Act thing. Fortunately, we got our feet wet on doing that, and everybody, administration, everybody really did a phenomenal job. And so I know you guys aren't going to do any less than what we did coming into the CARES Act money. Thank you so much for this presentation, and it gives me a little hope in knowing that we're going to be able to pay for some things that really need to be taken care of. And thanks again. And I know that we're going to be hearing a lot more from y'all in the near future. Thanks a bunch, Kathleen.
Commissioner Walters?
Thank you. I want to echo Jane's comments and congratulate Kathleen on surviving reading the document. Sounds like you have invested a lot of time in it. I appreciate the presentation. I do have a question. I didn't hear Bonner Springs or Edwardsville mentioned. And how are they on their own on this, or how will we coordinate with them, if at all? Has that been decided at any level?
Okay, so as I mentioned earlier, one of the things that Treasury is doing right now is here. I mentioned that here is that they're making sure. Yeah, they're making sure that they have the right methodology, formulas, and census data. in order. So the estimates that we received that bases that 89.5 million are based on information from, I think, OMB at the time, but they haven't released any updated estimates at this time. So that long list of all the jurisdictions and how much money they're getting, unfortunately, Edwardsville and Bonner Springs were not on the list. And so we have been talking with our federal lobbyists to find out what's going on there. And apparently, I'm just assuming that apparently whoever did that initial estimate assumed that as a unified government, that those jurisdictions were part of the unified government. And so, so we've been talking with the federal lobbyists about that. And we anticipate that there will be a re-estimate of the payments, and that Edwardsville and Bonner Springs will get their own after that estimate is revised. But we're working with the federal lobbyists, and I think maybe Doug might want to add a few comments. So
I would, Doug Bach, County Administrator, and to further clarify, all other jurisdictions the size of Bonner and Edwardsville get their allocation based on what goes to the state, and they designate out their specific amount of money. So they should have called them out separately so they would get it, and we should not have to share ours. One of the things they talked about specifically was for the city of Kansas City, Kansas, our allocation was based on our CDBG funding percentage. So that's just based on the percentage of population of Kansas City, Kansas. That's pretty clear that that's how they did our funding, and we're pushing that point pretty hard, that you just don't go and all at once add 12, 14,000 people to it and use the same formula. So that is one that is still being worked on, and we hope it'll be clarified. There were many jurisdictions like that were left out of the formula, so they're not the only two across the United States.
yeah, the jurisdictions that got direct payment had populations in excess of 50,000 population. So they're called metro cities. So.
But,
Thank you.
but your point here, to be clear, is that there is a way for Edwardsville and Bonner to access ARPA funding through the state. Is that correct?
That's how it should be done, though all the other cities in the state of Kansas were called out in the ARPA program to say, this is how much money they'll get. Here's the amount of money that's going to Kansas, and here's how much each one of those jurisdictions should get. Bonner and Edwardsville were not on that list.
Yeah.
Okay.
So we are working to assist those communities to get that corrected. I know they're talking to them, and we're talking to who we can and letting our local delegation, well, they're aware of it.
All right, so we will expect regular updates, and we will, again, the horns that Commissioner Markley was speaking to, we will